So our architecture right now, we're a two-layer hyperconverged architecture. And what I mean by that is that we're virtualization down to the storage level. So we're using Nutanix as our information technology backbone. That's structure. We have two data centers that are 3.3 miles apart. And overlaying the application layer, we are using Citrix. Citrix is our application layer. And then, through that application layer, we're deploying our EHR, our EDR, our practice management system, which is from NextGen. So we're using NextGen Healthcare's entire suite of application. And not only are we just using those three applications, we're also using them for their telehealth, integrated telehealth solution. We're also using them for our actual RCM, our revenue cycle management platform. We're also using them for our population health tools. So all of these things, and me as a CIO, one of the things that's important to me is database interoperability. And I'm not just talking about interoperability where you can plug in. No, I want it actually interfacing directly with our chart, with the medical chart. So our providers, when I'm looking at the quadruple aim, I'm looking at that provider satisfaction. So the more that we can have that's integrated, that is able to take the burden off the provider, we're going to introduce that. So that's just a quick application layer that from the clinical side that we're using to produce care and quality care, I might add, for all of those 50,000 patients. We're just proud just last week to receive PCMH certification again for all three of our sites. And so that's patient-centered medical home, which is a very, very big deal. I think we're one of 27 in the state that qualifies at that level. So that again points to the quality care that we get. But part of that application process is they look at your network. Are you able to submit data using HL7s? Are your CCDs at the right versioning level? And because of this infrastructure that we have, not only with our information technology, but with our clinical applications and our practice management applications and our revenue cycle management applications, we're able to produce internally and externally the proper versioning that is needed for those certifications.